everyone, I'm Melissa here and welcome to your Melissa Moment. Hello everyone, Melissa here. Welcome to your Melissa Moment and welcome to Wellness Wednesday. This is a reminder video to take care of your health and to listen to your body. Okay, I have talked about Canadian healthcare in past videos. So a lot of what I say is going to sound familiar. And please, just a reminder, these are my opinions. I am not a doctor. I am not currently practicing in the healthcare field at all at this point. But this is just me. This is my experience. This is my opinions. This is me. And I just wanted to share with you because I'm sure some of you have also experienced some of these things. I'm just going to adjust you. There we go. So I am different. I am not your typical person when it comes to fitting in the box. And I'll explain what I mean. A lot of times when you get sick, you know, there's symptoms. It's like, oh, well, if you get a cold, these are the symptoms you're going to have. If you have these symptoms, that will help you determine that you have a cold or a flu or whatever it happens to be, right? My body, and I can't explain it, it doesn't respond the way most people do. It just doesn't. And that makes it difficult to be in my position because when I have symptoms of something and I don't know what it is, doctors are very quick to dismiss me because my symptoms do not fit in their little box of symptoms. I have literally had a doctor in the emergency room, Royal University Hospital in Saskatoon, say to me, your symptoms don't fit the symptoms in our book. Therefore, we don't know what's wrong with you. We're sending you home. I had a doctor literally say that to me. I'm sorry, you're a doctor. Throw your book away and figure out what's wrong with me. Like, can I get a, doctor that actually does, diagnostic testing, actually will look at my symptoms and not just lump me in with the masses of, well, this must be it, or this must not be it because you don't have them all. You don't check all the boxes. No, I don't. I'm a person. I'm a person. And I have other things going on. You shouldn't just lump us all together. Everyone is different. Maybe I have other health issues going on that are causing my symptoms to not look the way everyone else's does. It's so frustrating. I do not appreciate the way doctors in Canada treat us as patients. I'm very thankful and grateful that our healthcare in Canada is free. However, if you've ever heard that saying, you get what you pay for, I think a lot of Canadians, especially today, are really understanding what that means when it comes to healthcare because ours is free. And the healthcare that we receive in Canada, you get what you pay for. So long story short, I've been feeling not 100% lately. And when I say lately, I mean I don't even know, a couple months, maybe 6 weeks. I don't know. And it started with my back. Now, I have back issues. I have had back pain for years and years because of my back issues. And I started getting back pain. And I'm like, oh, here we go again, back pain, right? But it would flare up and it would be just weird. And I never put two and two together. So I was having back pain, and I don't typically go to the doctor, especially today, because it's a waste of time. You have to wait for hours sometimes to see a doctor. If you need to make an appointment with your family doctor, well, good luck getting in before the next 8 weeks. It's really hard to get in to see our family doctor. And when you do go to an emergency room or a walk-in clinic, typically you have to wait for at least 2-3 hours before you even see a doctor. And if you're lucky, they're not just going to dismiss you and send you home with Tylenol, which they usually do. So I try not to go to the doctor, which is probably not the best idea, but I feel like it's a waste of time. So I do a lot of trying to figure out what's wrong with me myself. I do a lot of research. I take a lot of like over-the-counter things when needed. And I say when needed because I also do not like taking medicine if I don't have to. So I try natural things to do to try to fix things. So when I started getting flare-ups in my back, I go to my physiotherapist on a regular basis. I go to my chiropractor on a regular basis. But I let them know, hey, I'm having back problems. I'm having a flare-up. And they do what they can to try to assist me. I'm very lucky that my physiotherapist is amazing. Now, if you know him, don't tell him this because it's going to go straight to his head. I would never tell him he's amazing to his face because that's just not the relationship we have. We have a relationship that goes back a long time. I have been his patient for over 25 years, and he's my annoying big brother. That's who he is to me. And we banter a lot, and that's our relationship. At the end of the day, though, we get each other. Like I said, I've been a patient of his for over 25 years. So he knows me, right? Typically, he treats my neck because I had a lot of migraines and headaches and issues, but he's also treated my back. And he knows the problems I've had in the past, and he just understands where the pain is, what my body needs to relieve that pain. He's great. And I talk to him because we have known each other for so long. So I made a point of saying, I'm having this flare up in my back. He's great at figuring out what's wrong or just communicating with me and maybe triggering something where I'm like, hey, wait a second. And that's exactly what it was. I had a light bulb moment. So I told him where the pain was. He's asking me questions. Honestly, when I have issues with my health, I talk to my physiotherapist more than my family doctor because my physiotherapist has helped me determine what is wrong with my body more times than a doctor has. That's how good he is. And a lot of that is just because we've known each other for so long. So he's asking me all these questions, and he's asking me smart questions. And I'm telling him the answers, and he's like, well, that doesn't make sense. That doesn't make. And then he starts manipulating my back and seeing where the issue was. And he's like, it's on both sides. I'm like, yeah, both sides right here. And he's like, okay, that's like your rib area, like your floating rib area. And he's asking, did you fall? Did you hurt your ribs? I'm like, no. And then he's like, well, that could also be kidney area. And then I started thinking about it, and I'm like, well, gee whiz. This pain is the same pain I had when I had a kidney infection. Now, I don't know why, but in the last 2 years, I've been having, I was going to say a lot of kidney infections. It's not a lot when you think about it because it's like once a year. But for someone who's never had a kidney problem and now I'm getting infections in that area, for me, it's a lot because it's way more than I've ever had. And I'm like, maybe it's my kidneys. And I'm also confused at how I can be having kidney infections because I'm drinking at least 2 liters of water a day. I don't have any other symptoms. And that's what's frustrating. And that's what I'm talking about. My body does not act like most people. When you're talking a kidney infection and you're talking UTI infection, all that stuff, there are symptoms, right? It's like, oh, it hurts when you pee. It burns when you pee. It's hard to pee. You're peeing way more than normal. There's an odor to your pee, a dark color to your pee. You know, there's all of these things, fever, vomiting, nauseous, all these symptoms, if you look it up, and I don't have any of them. I don't have any. So I'm like, the only symptom I have is back pain. So I'm like, geez, is this an infection without any symptoms? So I'm like, you know what? As much as I hate doctors, I'm going to have to go because we have a trip coming up soon and I don't want to get sick on this trip. Now, the funny thing is, our daughter, who is 8, she ended up with a UTI while we were on vacation. I've talked about this in past videos. And she was really sick. She was admitted to the Children's Hospital while we were on vacation in Las Vegas. Thank God we had insurance. Thank God the doctors and hospitals in America are amazing. And it was determined that she had a UTI. Now, same thing. My daughter did not have any symptoms of a UTI. She didn't have any. She didn't complain about anything. She didn't complain about anything, you guys. I didn't notice anything. It wasn't until she was vomiting and sick that it was determined it was a UTI. Frustrating. So I have this back pain. So I'm like, you know what? I better just go. Now, I can't, like I said, can't book in with my family doctor because I gotta be waiting 2 months. They do have a walk-in hours, but you're still waiting for a long time. So I'm like, no problem. I'll drop my daughter off at school today. I'll just go to a walk-in. It'll be first thing in the morning. Hopefully I won't have to wait long. So I went to a walk-in clinic that was close to my daughter's school after I dropped her off. And I walk in and the waiting room wasn't full. It wasn't full, but there was probably, I don't know, 8 people sitting there. And I'm like, hi, do you take walk-in patients? She's like, yes. I'm like, okay, great. And someone ahead of me, I didn't hear what they said, but they left. So I said, how long of a wait? You guys, they opened like 45 minutes before I got there. Okay. Not even an hour. And there were 8 people in the waiting room. She said a minimum 2-hour wait. Minimum. How? There's 8 people here. How is it a minimum 2-hour wait? And you haven't even been open for an hour. How can you be that behind that is how long the wait is? So I did not want to wait. I had other things to do. I said, okay, I'm sorry, I'm going to have to find somewhere else. Like, what is wrong? Like, I don't understand. So I'm like, okay, I don't know. Like, we have lots of doctor's offices here where I live. There's tons, but not all of them are walk-in. And I'm like, I'm familiar with a few walk-ins, but again, I know they're going to be a long wait. So I'm like, well, I will just, I was going to the gym. I'm like, well, I will drive to the gym, and if I see a clinic on the way, I will stop. So I was going to the gym. I found a clinic, and I don't remember if I've ever been to this one. I'm like, I don't know. But I'm like, whatever, we'll go here. And I walked in, and I got to say, number one, I walked into this clinic. It was beautiful. Like, their waiting room had like faux leather chairs, and they were spaced out, and there was carpets, and it felt warm and cozy and welcoming. Not like most walk-in clinics that are very clinical, you know, everything's white and they've got like linoleum floor and plastic chairs, and you're close together with sick people and you feel uncomfortable. This was lovely. And there was about 4 people sitting. and some were sitting together. So I'm like, okay, this is looking promising. So I said, hi, are you a walk-in? And she's like, yeah. I'm like, okay, great. I said, if I could see a doctor, please. She goes, have you been here before? And I'm like, I don't remember. I don't know, maybe. So I gave her my health card and she looked me up and she goes, okay, we do have you here, but we have your last name different. You guys, they still had my last name from when I was married, like, I don't know, 20 years ago. And I'm like, nope, that's not me anymore. So they updated my info. They had my old address from like 20 years ago. So I'm like, so they updated everything. That was fine. So then they're like, okay, have a seat. I'm like, great. So I sat down and I wasn't waiting that long. And they called my name. Well, they had asked, why are you here? And I told them, I said, I think I have a kidney infection or a UTI. And they're like, okay, have a seat. And it wasn't that long. They called my name. And the nurse came and she's like, hi, she gave me, of course, the little cup. She's like, we just need a sample. You can just leave it in the bathroom and then just have a seat again. We'll call you again. I'm like, okay, great. So I was like, I don't know why. Like, I knew I was going to have to leave a sample. So I did take my big water bottle with me and I drank the whole thing before I got there. But every time I know I have to leave a urine sample, I get nervous that what if I can't leave a sample? I mean, I was able to, so it wasn't a big deal, but I feel like, oh my gosh, what if I can't? So it's fine. So I left a sample, left it in the bathroom, went and had a seat. Again, it wasn't very long. They called me again. And this was odd. You guys, it was odd. So they called me again. They take me into a room. Now, normally, I'm used to going into, you wait in the waiting room, then they take you to another little room where you wait for the doctor again, right? This time when she took me in, she took me to a room. The doctor was already in the room. It was odd. And he's sitting, like, they have a chair for you to sit in, or they have the little table, right, the exam table. And he's sitting here in a chair facing the computer to a wall. So that was odd. I don't think I've ever gone to a room where the doctor's already been in there. It was weird. So that's fine. Now, there's a lot of doctors, and I'm not one to judge. But I did notice this doctor looked older. Also, this doctor was overweight, which I don't have a problem with, but I do find it interesting because I don't typically see many doctors that are overweight. So that's fine. Now, he was sitting there. Now, obviously, he has had something happen to him in a sense that he either, I don't want to speculate, but I noticed he was quite shaky and he had trouble moving his hands and he was quite slow with his movements. So I'm not sure if he was experiencing some kind of neurological issue or if he had been in an accident or a stroke or something. He also was wearing double masks, which again, I get it. It's a doctor setting. But it made it very hard to hear him. So I walked in and I sat down and I'm like, hi, how are you? And he's like, I'm good, thanks. How are you? I'm like, I'm okay. And he hasn't really looked at me. Like where I'm sitting, I'm seeing his side because he's on the computer. And he hasn't really looked at me. And he's typing away very slowly. And sometimes he even has to take his one hand to move his hand on and off the mouse. So I'm not sure. But I wasn't feeling confident at this point. I'm like, okay. And I always hate this because they always ask the same question. It's like, why are you here? You should know why I'm here. Because when I checked in, they asked why I was here. And the girl gave me a cup. So she knows that I think I have an infection. Did you not read the file? Like, you should know why I'm here. So I said, I think I have a kidney infection or a UTI. And he's like, And again, it was really hard to hear him. I felt bad because I kept having to be like, I'm sorry, or excuse me. Like, I felt bad, but he's a bit of a low talker to start with. He's also got 2 masks on, so it's a little muffled, and he's not looking at me. So he's facing away, so his words are going this way, so it's hard to hear. So he started asking me questions like, do you have a fever? I don't think so. Like, they didn't take my temperature, and I don't feel like I have one. And he goes, are you going to the bathroom a lot? I'm like, well, I don't think so, because I drink a lot of water in a day, so I go to the bathroom a lot to begin with, so I don't know. He's like, well, is there blood in your urine? I don't think so, but I do get my period once in a while, so I don't know if it's because of that or if it's because of an infection. Like, I can't determine, I don't know. He's like, do you have any symptoms? I said, the only symptom I have is back pain. That's it. Now, what bothers me is the fact that he asked me, why are you here today? Because he already had my results of the urine test. He already knew. So why go through all of this? I don't know. But anyway, he says to me, you do have an infection. And again, he said it low and it was muffled. So I was just like, oh, I do have an infection? And he's like, yeah. I said, oh, okay, great. I was right. Like, and then he's tippity tapping away on the keyboard. And I'm like, I said, so do we know, like, is it a UTI or is it a kidney infection? Like, do we know? Can we determine what it is? Because typically when I get the back pain, I've been told in the past when I've been having infections that they've said, you have a kidney infection. Like, it's beyond UTI. That's why your back hurts, because it's a kidney infection now. So because I have back pain, I assumed maybe it was a kidney infection. So I said, can we determine? And he's just like, it's a UTI. And I'm like, oh, okay. So we know it's a UTI and not a kidney infection. Okay. And then he's tippity tappity and he goes, do you have any allergies? I'm like, yeah. So I'm allergic to a couple medicines. So I told him, this is what I'm allergic to. This is what happens when I take them. I also can't have, like, NSAIDs or ibuprofen or anything like that. So we make little notes. And they had asked me in the front when they were updating my info which pharmacy I use. So I told them. And again, he asked me, and what pharmacy? And I'm like, I don't understand why I have to repeat myself. Like, I've already told them. It's in the file. Like, it's fine. It's fine. So I told him which pharmacy I use. And he's like, tippity tappity tippity. He's just like, okay, I've sent in the prescription. You can pick it up there. And I'm like, oh, okay. So obviously I'm on antibiotics. He's like, yep. I'm like, okay. 7 days worth? Yep. Great. And like, I just feel like you're the doctor. You should be taking control of this conversation. But I felt like I was the one doing it. So I said, okay, is there anything else I should know? Like, obviously, I assume just drink lots of fluids. He's like, yep, drink lots of fluids. I'm like, okay. Well, thank you so much for your time today, sir. Have a great day. And then I left the room. And as I'm leaving the room, I thought I heard him say something. But again, low talker, masks. I'm literally out of the room. So I'm like, do I go back? Was he talking to me? Was he like, I didn't know. So I just kept going. I'm like, whatever. They have my number. If it's something, they'll call me, right? It's something fine. So then I go and I pick up my antibiotic. And it's the same, like, you would like, I don't know what it is in the healthcare here. It used to be when I go and pick up medication at the pharmacy, the pharmacists were always really good. They'd be like, oh, have you had this medication before? and you'd say yes or no, and they'd be like, oh, okay, well, here, let me tell you about it. This is how many you take. This is blah, blah. Like, they go through everything, right? I go and pick up my prescription today, and I don't want to call her a pharmacist because maybe she's not even a pharmacist. She's just working. I don't know. But she didn't even, like, usually they show you the pills, right? Like, here's the pills. This is how many. She didn't even show me the pills. She just, boop, this is how much it is I paid. And then she's like, did you have any questions? And I'm like, well, you haven't told me anything. So, I mean, I've taken antibiotics before. So I'm like, yeah, so just like 2 pills a day for 7 days? And she's like, yeah, that's right. And I mean, there's obviously stickers on the bottle. It's like, take with food, may change your urine to a different color. Like, there's little things on the label, but still, and they give you the little papers. But I'm like, she didn't even tell me how many pills to take and how long to take them for. I mean, I know it's on the bottle, but still, like, you can't even do that. So whatever, it was fine. So I came home and I'm like, well, I better take my first pill, right? So I had lunch. I took my first pill. And then I took my pill, and then I'm like, well, I better just read through the information just to make sure, because I don't think I've ever taken this antibiotic before, this specific one. I looked it up. It says it's for UTIs. It also says it's specific for UTIs and doesn't usually help with kidney infections. So I'm hoping that it is a UTI and not a kidney infection. Like, I don't know how he determines that it wasn't a kidney infection, but the fact that I have no symptoms except for back pain leads me to think it might actually be a kidney infection and not a UTI. And if it is a kidney infection, then these pills probably aren't going to be enough. And how am I going to know if the infection goes away or not? I don't know. It's a whole thing. But anyway, I was reading through the information, and it specifically says in there, we recommend you avoid spicy food, coffee, and alcohol. Well, I literally just had spicy food and coffee. Actually, coffee is what I used to wash down the pill I took. So I'm like, well, that's just great. That's just great. It's fine. It's fine. I'm sure everything's fine. So this is my frustration. And this is my reminder to you. Listen to your body. Because you may not respond the way most people do. You may not check off all those little symptom boxes that determine this is what you have. It doesn't mean that you don't have that. Because if you're anything like me, it doesn't make sense. It doesn't make sense. But I listened to my body. I'm like, something's not right. Something doesn't feel right. This pain reminds me of the last time I had an infection. So I decided, yeah, I'm going to go to the doctor. I'm going to get this figured out. Now I'm on antibiotics. So hopefully this helps. Like I said, there's no way for me to determine if it's a UTI or a kidney infection. Therefore, I don't know if these pills are going to work or not. I also don't know if I'll be able to tell if the infection is better after I'm done taking these antibiotics or not. And a lot of people would say, well, if your back pain goes away, then you're better. Normally, I would agree with you. However, as I've stated, I have back pain every day, all day. I've had for years. So I'm going to have to determine if the back pain is a kidney pain or just my normal back pain, which sometimes is hard to decipher. So, wellness, isn't it great? Yeah, that's my little tip. Listen to your body. And if you know something's wrong, because I feel like, especially women, we have this little intuition where we just know something's not right. Don't give up. If you have to go to more than one doctor, go to more than one doctor. Find one that'll listen to you. Find one that will take the time to figure out what's going on. because I think we know ourselves, right? And the human body is amazing in the sense that it does try to tell us things. When something's wrong, we usually get some kind of signal from our body or something to be like, hey, not working at 100% here. So that's kind of my video for today. I hope these antibiotics help me. I have a week. We'll find out, I guess. I don't know. But yeah, that's it for today. I'm going to go and rest because I'm not feeling 100% today. But that's okay. I hope you guys are feeling good today on this Wellness Wednesday. Let me know. Healthcare, specifically Canada. Have you had wonderful experiences? Have you had horrible experiences? Do you try to avoid it like I do just because you don't want to deal with it? Let me know. Love to hear from you. Love to hear where you're from as well. And if there's any of my American friends who are watching, tell me your thoughts on your healthcare system and if you've ever experienced Canadian healthcare. Because as a Canadian, I know what American healthcare is like. I'd love to hear an American's perspective on Canadian healthcare if you've ever experienced it. So thank you so much for watching. As always, I appreciate every single one of you. We'll see you guys next time. Bye.